All right, so this is Mr. Stinson. He's a 52-year-old male. He's got a history of hypertension, diabetes mellitus, chronic kidney disease, congestive heart failure. He came to the ED with severe itching, nausea, vomiting, pale, lethargic, shortness of breath, crackles in the lungs, and he's admitted to your unit. So I'm not going to introduce myself. Hi, Mr. Stinson. My name is Emily. I'm going to be your nurse today. Can you tell me what's going on? So I'd ask him why he came here. Obviously, I already know that itching, shortness of breath, nausea, vomiting. So I would introduce myself, wash my hands. I'd get a set of vitals on him. I'm just going to get some vitals on you, okay? See what's going on. All right, blood pressure is 153/97. Listen to your heart for a minute. All right, so his heart rate is 102, respirations are 24 a minute, and his oxygen sat is 90%. So as of right now, my additional nursing assessments that I would do would be a head to toe assessment, lungs, skin, make sure that there's no different like color, turgor, I'd check his skin. So I'd go down through and do a head to toe assessment. So I'm just gonna look you over real quick, okay? So I do pen light, look in his eyes, equal reactive. I take his temperature. They didn't have a temperature noted, so I'd go down through, I'd listen to his lungs. I'd have him take a deep breath every time I put my stethoscope down. Have him sit up and I'll listen to his back. I listen to his abdomen. Alright, so I'd have him sit up and I'd look for JVD. Nothing is noted. I'd go down through and I'd check his radial pulses, see if they're equal bilaterally. Skin turgor, cap refill. I'd have him push and pull my hand, see if it's equal strength. I'd palpate his abdomen to see if there's anything, if anything hurts or anything like that. I'd go down to his legs, check pedal pulse, pushes, pulls, check for edema. I'd ask him if there's any changes in bowel movement, urine, anything like that. So after that, my assessment would be, I'd look at his dialysis site, whether that be an AV fistula or a graft. So I would just want to double check that there's still blood flow at the pulse distal from that. So say it's in his forearm, I'd check his radial pulse just to make sure that they're still getting blood flow to it. I'd feel the thrill, hear the bruit. I would then also I'd probably want to do a neuro assessment. I know dialysis can cause, or chronic kidney disease can cause issues neurologically, so I would want to double check that as well. Some diagnostic tests that I would expect to run would be CBC, check white blood cells, platelets, everything like that. A BUN, creatinine, maybe a kidney function panel, electrolytes for sure to see if maybe he's got some dehydration going on. ABGs to see if he's maybe more acidic or alkalotic. And then I would make a note of that. I would go see if the doctor wants to order those labs. I would put those orders in the computer, and then I would come back and see, we'd wait for the results and see what's going on. So I'm gonna go get some, or go chart some stuff for you, okay? I'm gonna go talk to the doctor and see what he wants. Here's your call lid if you need anything, okay? So I'd wash my hands and leave. All right, Mr. Stinson, I am back. So they did run some labs on you. I have some results. So it looks like your BUN and creatinine are off. So that could mean kidney failure. So that means there's excess waste. buildup in your blood, so the kidneys aren't filtering properly. You have some anemia going on, so that's very common with chronic kidney disease, with the lack of erythropoietin in the blood. Potassium was high, 6.3, so hyperkalemic. That normal range is 3.5 to 5.0. Has hypomagnesia, hypocalcemia, hyponatremia. The BNP was elevated, so that means that there's maybe a little bit of fluid overload going on, and it does look like with his pH, his PCO2 and HCO3, that he has some metabolic acidosis going on. So I would want to just like double check, keep an eye out, especially that potassium since it's so high, just to make sure that there's no arrhythmias or anything like that. So I'd probably want to get an order for a heart monitor just to make sure that he is on the telly so that we can see at the nurse's station what's going on even if we're not in the room. So it looks like he left for dialysis and he came back and he had maybe 3 liters of fluid drawn off of him. So physiologically wrong with him, I would say that he isn't feeling well because he skipped his dialysis. That means that there's some extra fluid going on, fluid overload. The dialysis is necessary and it needs to be done regularly per doctor's orders so that it does filter everything that it needs to be filtered, since his kidneys aren't doing that themselves. And I'd also want to keep an eye on that potassium since it's so high, just to make sure that nothing turns into cardiac issues. So I would, so I'm gonna go talk to the doctor about your lab results. I will be back, okay? Here's your call light. All right, so before he goes to dialysis, I would want to check his weight just to see, especially when he comes back, just to double check if there is any significant change in that weight, to see if there's any water drawn off or excess toxins. I would want to double check what meds he's taking before he goes to dialysis, just so that, since that dialysis does filter things out, just so that that med that he did take prior to dialysis wasn't just taken for no reason, since it would be filtered out as well, since it takes everything. And then I'd also want to listen to the heart and lungs, see if there's any crackles going on, and then that heart for sure, to make sure that there's no arrhythmias with that high potassium level. And then after dialysis, I'd want to check his weight again, just to see if there was any progress with the fluid retention, the fluid overload, see if there's anything that was significantly drawn off. I'd want to get his vitals as well, a full set. I know that dialysis can like tank your blood pressure just because it's drawing out all the water from your blood, so that does lower significantly. So that's another thing, you wouldn't want to take a heart or a hypertension medication prior to dialysis, because it would lower the blood pressure, and then with that, everything being filtered out would lower even more, so it would tank them out. And then I'd also want to see, maybe see if the doctor wants to order another set of labs, just to see if there was any progress with the filtration of electrolytes, and maybe that potassium lowered, see if the BUN and creatinine, all that has changed significantly. So the doctor did order some erythropoietin subcutaneous, so I will go get that and I will come back in and let him know and administer it for him. All right, Mr. Stinson, I am back. So I talked to the doctor and he ordered some erythropoietin, 200 units of it subcutaneous. So that is a small injection in your abdomen. So I'll just do that real quick. It's gonna help your kidney function a little bit, so hopefully. So before I administer, I check his name, date of birth, wristband. I go through the 5 rights: right person, drug, route, time, and dose. So I double check with the MAR. And so to inject this, I would get to his abdomen. I'd look for the right or left. I'm gonna do the left side because it'll be easier for me. Superior or anterior superior iliac spine and the 10th rib, 2 inches from the umbilicus, avoiding the belt line. I would palpate, find that area. I would Clean with an alcohol swab in a circular motion around it. I double check allergies too. I would pinch that skin up, inject the syringe, inject the medication, put this in the sharps container. It might bleed, so Band-Aid just in case. So then after that, I would just cover him back up. Throw my gloves away. I would wash my hands beforehand as well. I would chart that it was given, that there was no issues going on with that, and I would come back in 30 minutes to double check that there's no adverse effects. And then I would get vitals again every 4 hours. That erythropoietin was just one time, so that won't be needed again unless the doctor decides to order it. So as of right now, some important patient education for Mr. Stinson would be that dialysis is not optional. Even though he did not feel well, a lot of times they don't feel well because they didn't go to dialysis. So I would want to remind him that the dialysis is for a reason. It's to help filter things out, so that extra toxicity in his blood was probably making him feel crummy. So I would teach that you only really skip dialysis if it's something serious, like a serious illness, or you physically just can't get out of bed, infection, fever, anything like that. I would also want to, sorry, I got distracted, teach that maybe he, oh my goodness, I would teach that he would want to follow a medication regimen regularly, maybe request that he gets a consult to a nutritionist to come up with meal plans that are low potassium, since that potassium level is so high. And I would want to just, again, emphasize the fact that dialysis is not optional. He will feel crummy if he does not go. And I would want to teach that, which he had probably gotten taught before, but that fistula or the graft or whatever he has is no blood pressure cuffs, no IV sticks, no blood draws on that arm, nothing heavy, no constricting clothing, just since that is so pertinent for that dialysis, just to make sure that he is aware that he can't really mess that up, otherwise things won't go well. So I would explain all that to him and give him paperwork so that he is aware of that after the fact. He has it written out, so if he forgets what he and I had talked about, I would wash my hands, and then he would be free to go. All right, Mr. Stinson, you have a good day. I hope you don't have to come back. Make sure you go to that dialysis regularly so that we're not back in the same situation, okay? All right.